Hi, this is Ricky Greer, BSN nurse, Master of Science in Nursing student, okay? And I'm here to present you the lung transplant program, okay? Initiating the first established lung transplant program in the HCA system at Methodist Healthcare Hospital, okay? Methodist Heart Hospital and its CVOR. Methodist Heart Hospital is the flagship hospital of the South Texas Medical Center. The CVOR, of which I'm a part of, circulator, as well as charge nurse, we're well versed in the coordination of transplant services, doing the well-established heart transplant program. We're an experienced CVOR, where most lung transplants will take place. Experienced CVOR staff were adjusted to higher acuity patients as well as more critical and intense surgeries. We're well used to taking care of more sick, diseased patients, patients that need much higher level of care than a regular standard operating room. Another thing is the Methodist Heart Hospital has access to vast resources for both patients and healthcare professionals. Okay, this is because we're part of the South Texas Medical Center. Remember, we're the flagship hospital there. Okay, why did we choose to do lung transplants? Well, now, as most health professionals know, we have an aging baby boomer generation driving healthcare. Why is this happening? Well, the aging baby boomer is the largest cohort to go through the United States medical system, period. And tied with the aging baby boomer generation right now is vast amounts of wealth. It's the baby boomer is the cohort with the most amount of wealth. So because of this, they're willing to pay for healthcare that is available to them, and because this is the cohort that is the largest, they're pretty much driving healthcare. Okay, the lung transplant list is backed up, so it's never totally completed. So there's room for more lung transplant operations there. We are set up for transplants. We do heart transplants now pretty regularly. We do them regularly, and we do them well. Our stats on heart transplants are pretty positive. So we think we can make the transition from hearts to accommodate lung transplants on the cardiovascular operating room. Why else are we doing this? We're doing this, of course, for our patients, patients population of the United States. We want them to have better quality of lives, of course. A lung transplant patient that has a successful lung transplant surgery can have up to 10 years added to their life. And we live in reality here. Hospitals, they need finances. Lung transplants, profits from lung transplants can be substantial. Okay, what patient care model are we going to use? We're going to use a total care model from beginning to end. What does that mean? Patients will be selected via requirements they meet: blood type, disease history, age, etc. And they're going to meet the protocols for the lung transplant list. Once they meet those protocols are in place, those protocols that are placed on that list, total care starts. Before the patient even enters hospital, we're going to put them on the right diet. We're going to make sure their labs meet the correct protocols. We're going to make sure they're taken care of even before they get to the hospital. And then once they arrive to the hospital, of course, they'll arrive 2 days before surgery. We're further do more lab testing. We're going to make sure the patient's in the perfect position for this surgery. It is an intense surgery, so we want to make sure the patient's positioned the best possible for it. Also, we want to make sure the patient's totally clean on their body to cut down on infection rates. Of course, transplant patients get on medications that dampen their immune system, so we want no bacteria on them. Surgery will take place on day 3. The operation will happen in the CVOR. Post-op, the patient will go to the new transplant intensive care unit. Okay, we're building a dedicated transplant intensive care unit for our patients that will accommodate both heart and lung transplant patients. Okay, strategic planning. This is year 1, building the foundation. Year 1 will build the base of the program. Staffing will be adequate. We may need to hire some more nurses, some more scrub techs, but more so than that, we're going to have to train our staff, train nurses, train scrub techs on the new lung transplants. Not only that, we're going to have to, with the new transplant ICU, we're going to have to make sure that ICU nurses are specially trained to handle that special patient population. Okay. Flow of procedure will be done in this first year. We're going to make sure we have all the surgeon's tools, We'll make sure that the new transplant's being built on time. The surgeon will also use this year to do practice lung transplants, where he will do mock surgeries with the team, so that way when the actual surgery comes, it flows smooth and we have no hiccups in the actual surgery. We'll be well versed in it. Okay, staged year 2, strategic programming, year 2, program probationary period. For the program to be successful, we need 10 successful lung transplants. Okay, so during the second year, we're going to make sure we have those 10 surgeries. We're also going to make sure that we finely tune the program and the surgeries to weed out any imperfections. The transplant ICU will accommodate mostly heart transplant patients at this time, but the new ICU will be built at this point, and to keep patient traffic going there, again, we'll use heart transplant patients and, of course, the 10 lung transplant patients. Lung transplant patients taken the transplant ICU. The staff, since it will be the second year, the first of the lung transplants, this will be great for the ICU staff to gain that critical experience of taking care of that patient population. But in the meantime, in the second year, we'll mostly have heart transplants there. Strategic planning, year 3, will be cementing the program. Lung transplants are a regular occurrence at 30 to 40 surgeries a year. That's the bar we've set for ourselves. Okay. Transplant intensive care unit is at full operation, accepting both heart and lung transplant patients. The CVOR runs smoothly with the addition of the lung transplant surgeries. This is where we want to be in year 3. This is the bar we've set ourselves, 30 to 40 surgeries a year. The transplant ICU is running at full capacity, accepting all transplant patients, and the operating room is running smoothly. Now, marketing, nationwide marketing. Okay, what are we going to market first of all? What we're going to market that we are the flagship hospital of the South Texas Medical Center. That's what we're going to do. We're going to market that we now do lung transplant surgeries. Okay, we're going to market that we have a top 50 hospital. Of the 4,000 odd hospitals in the United States, we are a top 50. We have earned that at Methodist Heart Hospital. These are our points we're going to market. We're going to market, of course, that these points, and how are we going to do that nationwide? We're going to maintain an online presence. Okay, we're going to have ads online. Our marketing team is going to be aggressive in marketing. Ads online are going when a patient types in that they're looking for transplant services, our names are going to pop up. Our marketing team is going to make sure of that. We're also going to maintain a positive reputation. We already have a great reputation on transplant services now. We're going to make sure we do such a good job on our lung transplant services that it's nationwide well known, just as well known as our heart transplant. Okay? Not only are we going to maintain a positive reputation among patients, but also among doctors too. We want doctors to recommend our transplant program, the lung transplant program, just like the heart transplant program. Nationwide, our heart transplant program is recommended by medical doctors all over. And we want to make sure that the lung transplant program is on par with our heart transplant program. So maintain a positive reputation among patients as well as MDs. State and local marketing. In the state of Texas, 7 hospitals do lung transplant programs. One of them in San Antonio, right near our hospital. Okay? How are we going to set ourselves apart from that? Well, how are we going to market it? We're on a television presence. We're going to have commercials. Physical presence across all doctors' offices in Texas. We're going to have pamphlets, booklets describing our program. Patients go in to see these doctors. They go in to these medical facilities. They will see our books. They'll see our pamphlets. We will have posters everywhere. We will have a physical presence in doctors' offices, medical offices across the state. Okay? They will see what we do. They'll see what makes us different. We're a top 50 hospital, where they're going to see the brand new ICU with specially trained ICU staff that will take care of them, and they'll see that we are the flagship hospital of the South Texas Medical Center. Okay? Also, we'll be recommending, or we'll have a positive reputation. Okay? In 2022, 2,743 lung transplants were done. How many were on the list? Almost 5,000 patients. That means about half of the patients in the United States on that transplant list did not get a transplant. Okay? Transplants done. About half that. Here's our market share right here. Our market analysis indicates we may have up to 400 applicants a year through aggressive marketing. Okay? So this number here is we may have up to 400 applicants. That well meets the 30, 40 lung transplants we want to do a year. Through aggressive marketing, we believe we can achieve that. Okay. First year, loss of 20 million. That's a big hit. But the first year will be investment year, as 20 million is spent on new transplant ICU, surgeons' new instruments, and hiring and training of new staff on both CVOR and transplant ICU. We're building the foundation. It's going to take an investment. We will gain that back. Here it is. We're making $0, and then we bottom out at negative $20 million. For mostly going to building the new ICU. Year 2, probationary period. 10 transplants are the goal for this year. Surgeries must be deemed successful for a program to move forward. At $1 million for a single transplant profit and $1.25 for a double lung transplant, though, in the second year, we see we're moving up, and we could gain between 10 to 20 million, depending on the mix of single to double lung transplants we do. Year 3, program is realized. After a successful probationary period, lung transplant program is in full operation, as well as the transplant ICU. With 30 to 40 lung transplants happening this year, projections indicate profit to be between 30 to 50 million, depending on a mix of single or double transplants. Coming off of year 2, we steadily climb over the year and land between a profit of 40 to 50 million dollars, simply from the lung transplants at 30 to 40 lung transplants a year. So that well gets us what we spent in year 1. Okay, in conclusion, this is a 3-year, 3-step program. This is we aim to do a comprehensive total care for the patient from submission of application to months after exiting the hospital. The financial hit of 20 million in the first year will be substantial, but the following profit from the following years 3 and beyond, will well make up for that. All right, this is Ricky Greer, BSN. Thank you. I hope you enjoyed the presentation.